Welcome. So my name is Simba and I work as a head coach here at Living with the Spirit. I specialize in physical therapy, massage rehabilitation, tension and trauma release exercises, Reiki, and a lot of body-based modalities to heal the mind, body, and spirit. And today I'm going to address a question that I got from a friend of ours back home in Sweden. And the question was regarding a hip back related injury or discomfort that doesn't allow the person to fully flex the spine leaning forward. There was a lot of stiffness in this angle and also a lot of stiffness in the left hip. So they have a synergetic connection, like a very strong bond, the hip and the back. So many times when we work with the back, it's actually the hip that's the problem. And many times when we work with the hip, it can be the back. But either ways, it's my understanding and experience that you need to work with both in order to create circulation and stability in the area. So today I'm going to show some exercises on how to open up your hip so that you can feel a little bit loose and limber. This can be done before your exercise routines in the morning, before a session, before you go to bed, kind of whenever you feel like during the day. I usually recommend to do it in the morning and the evening to get full effect. But if you want to add more times than that, feel free to. And if you like our videos, please subscribe to our YouTube channel, and then you will get updates when we release more videos as we get more questions. You can also ask us if you have a specific question, and we will address it as soon as we can. So, first exercise, we're going to lie down on the side, like so. Okay, so we're going to work with the SI joint on this side. And if you imagine, if you see your pelvis from the front, it looks like the skeleton. It looks like two elephant ears. So where the base of the spine comes down is called the sacrum. Between the sacrum and one of these ears, or actually between both of these ears, you have a joint called the SI joint. It doesn't move a lot. It has about 2 to 4 millimeters movement. But if it's not loose and able to move, we can get a lot of stiffness and compensation in the lower back. So from here, we're just gently going to imagine that this knee slides on the rails of the underlying leg. So 90-degree angle in knee, hip, and feet. And from here, I'm not going to rotate my spine in any way. I'm just gently going to push my knee forward towards my hand. And then press my buttocks backwards towards my hand. Coming back and forth. And this is working with the upper leg, the right leg's SI joint. And we don't force the movement, you just go slowly back and forth like so. And you can do this about 10 to 15 times to limber up the SI joints. Next from here, we're going to do some circulation with the upper leg. So we're going to go around like so, open up, and basically getting a full range of motion in our hip joints as we move. I come all the way back, open up my knee, the foot comes in, try not to fall over to the side, but still have my left side on the floor, and I come back down. And it doesn't have to be super technical. You can do this movement technical, but just look for more range of motions. Just look for where you feel tightness and stiffness, and go slowly around these areas. And then we go the other way around. We come out, bring the foot out, and really move the leg around. So I come all the way out, the foot goes out, the knee comes in as I'm going down. And same here, about 10 to 15 times on each side. And then we come up and down. like so. This is just to loosen up the hip a little bit, to work on the hip flexor. And then we're going to switch position. So this knee's going to come forward. And from here I'm going to work with the upper back a little bit because they play a vital role together in rotation. So from here, I'm just going to face, my thumb is going to face, or my nose is going to face towards the same direction as my thumb. And I'm going to rotate all the way back if I can. And then coming backwards. I go to the resistance where I feel it. This knee stay on the ground. And I come gently up and down like so. About 10 times. Up and down. And most important here is that we don't lift the knee off the ground, that we're just rotating in this manner. And then we come to the other side and we start and we do the same thing. So we gently sliding leg forward and gently coming backwards. And I'm not trying to rotate this upper shoulder. This upper shoulder is facing the sky or the roof, wherever you're at. And then we push forward and gently pull backwards, like so. About 10 times to open up the left upper legs SI joints. And then from here, start doing some circles with the hip. Use this hand to hold on so we don't fall over. About 10 times or more, feel like it. And then going the other way around, the foot comes out and the knee goes down. And then we switch legs. Knee stays on the ground, this hand comes forward, and I work with the upper back. And we come back and forth like so. About 10 times. After we've done this, you can gently come up to a seated position, relax, loosen up the legs, and we're going to do something called a shin box. This is going to work with the internal rotation of the hip, which is something that in a sedentary lifestyle we usually don't do too much. So essentially, hip and shoulder width apart, or a little bit wider apart with your legs. Find wherever, if this is your position or this is your position, doesn't matter, wherever you can be. So from here, we're going to try to keep our upper body, our chest facing forward towards something. So find a pinpoint a location where your chest wants to be aligning against, and this leg's going to fall out and this leg's going to come in. So I'm going to do the internal rotation on this leg, and then I'm going to come out and the other leg's gonna come over. Note, I'm not rotating my body width. I'm trying to keep my upper body facing forward. So it might not come all the way down, and that does not even have to be the goal. Maybe this is the goal and you feel a pinching sensation here. That is okay. That is a little bit of what we are looking for. So this movement can be used to loosen up the hip, but it can also be used as an assessment for you to see how your hips are doing today. Maybe everything is hurting when you're doing this, maybe nothing is hurting. You can find some more space as you're doing it. From here we can also work with one leg at a time. So I bring my leg in, and this one comes out. I bring this leg out, and this one comes in. So now I'm working with my right hip. And if you have a floor, you can just slide, use a towel or some socks or something, just slide your foot in and out as you're doing this movement. And then doing the same thing for the other side, about 5 to 10 times each. When we're alternating sides, we can do 16 to 20 reps to get some circulation into the hip. Remember to breathe. Many times we focus so hard when we do movements that we hold our breath, and we forget that stretching is about bringing oxygen into an area that doesn't have as much oxygen. That's why it's tight in the first place. So by holding your breath, you're actually doing the opposite of what the body needs. And then if you like, we can do both at the same time. Really bring the legs far apart and be gentle on the knees. Come in, out, or just bring them in and come back to neutral a few times. Might feel a pinching sensation here, and that's perfectly normal. Don't push into a shear or severe pain. Discomfort is fine. That's not a problem, but no excruciating pain. That's just too much. It won't do any good. Okay, next exercise, we're going to use a band. So I have already set up my band, but you can use it around the pillar, anything that's stable, essentially. Anything that's stable and that you can bring it around. And you can find most of these bands in sports shops. This one is from Decathlon, which is a French sporting goods store that you can find more or less all over the world. So what we're going to do is we're going to create a little bit of traction in our hips. So it's kind of like this. You imagine the finger coming out of its joint a little bit, and then it comes back into the socket. And we can't really do this with our hip, because then we would be in big trouble, because it's the joint that carries the most load in the whole body. It carries the most weight. So what we want to do is create some circulation in it. And this is great if you have arthritis in your hip, or beginning arthritis, or any kind of discomfort that you have had in your hip and you need a little bit more circulation. So we use this one and just take a few laps to make sure that your foot is gently secured. And then we move back to where we can feel that we can create some tension. It's not going to be a big movement, actually. I'm just gently going to bring my right hip up, and then I'm just going to relax it down. I bring it up and I hold it for about 3 seconds, and then let it go. About 10 times. And then we do the same thing for the other side. Just toggle yourself. It can be a little bit of a struggle sometimes, especially if you have tight joints. And then from here, so imagine your hips are like this, and one side just comes up and down. So this side just comes up, I push down through the floor, and I relax down. And I move back, so at the beginning I'm feeling this leg is kind of being pulled down by the band straight away. So push up, I hold 2 to 3 seconds, and I relax. Push up, I hold 2 to 3 seconds, and relax. and about 10 times. And then I come out of it. And what I didn't show, but what you can do on your own, is that you can begin this session by doing the shin box. That you do the shin box a few times as the first two. And then you do this one, and you move your leg back and forth. Do the circulations, do all the rotations. You do this one with the band where you drag, you let your hip come in and out of the socket. And then you can actually come back to shin box and notice. Just demoing this exercises a few times, probably did 5 or 6 reps, not even 10. I can already feel a big difference in my hip. I feel a major difference in my hip in terms of more relaxation and more space. So from here we can do a lot of different exercises that will help to open up and to strengthen the hip. But I really say this is a good crucial start to begin and to have some exercises of going through and to open up the hip area. The last one I wanted to show today is to work with the inside of the thighs. So we're going to stand on knees and hands, foot out to the side like so. We want to work with the inside of the thigh, so either from the forearms or I stay on my hands. You're going to angle your butt upwards, lean back, and come forward. So we're working with the inner part of the thigh in this area. And we can also do like this, so arch your back and lean back. When I say arch, I mean the stomach wants to go towards the ground, and you want to have this pivoting, rocking sensation. This will make you limber as a cat and open up your hips. So tightness in the inside of the groin can usually translate to inability to move your lower back, which can create a lot of tension and pain in the lower back. About 10 times on each side. If this is hurtful for the knee, you can always use a pillow or a towel or something that supports it a little bit. About 10 times. And then you can come back to shin box. And I feel it's even looser now, especially for this one. So this is an easy way to start opening up the pelvis, the hip areas, inside groin, and that can prepare you for some exercises, some strengthening exercises, and just to go about your day, to have less pain. If you know you're going to walk a lot, maybe have a job that requires you to walk a lot, this is a great way to open up the areas and loosen up the hips so it feels nice and limber and loose and ready to go. So if you like this video, please subscribe and press like or leave a comment, and you can also ask us questions if you have any specific inquiries or pains or something that you would like to work on, and we will be happy to record our answer for you and some practical tools you can do to work your way through whatever situation you have physically, mentally, emotionally in your body. Thank you very much.